us in the studio for this week's health segment is Dr. Stephen Davis, professor and chairman of medicine at the University of Maryland School of Medicine and physician-in-chief at the University of Maryland Medical Center. It's a pleasure to have you here, Dr. Davis.
It's a pleasure to be here. Thank you for the invitation.
So we were talking about some statistics. 26 million adults have been diagnosed with diabetes, but then there's another 7 million or so. Well, I should say 18 million have been diagnosed, 18.8, and then there's 7 million that are undiagnosed. How is it that someone can walk around and not know they have diabetes? Is it as simple as they haven't been tested? It
could be. Although, let me add another scary statistic. There's another 79 million people in the United States who are at high risk of getting diabetes.
So these are pre-diabetic folks?
Yes.
And if you're pre-diabetic, do you automatically get diabetes at some point, or can you, stave it off?
About 1 in 7 people, or 15%, convert from pre-diabetes to diabetes each year. Okay. So you're at very high risk, but you can prevent it.
Let's talk about diabetes. How does it affect the body? What are some of the ways that it manifests itself?
So let's talk about this 3 main types of diabetes. There's the diabetes that used to be called juvenile onset, where the body attacks the insulin-making cells, and it's this hormone insulin that comes from our pancreas that controls blood glucose. Then about 10% or 1 in 10 of people with diabetes have that form. Then there's a much more common form, which is so-called type 2 diabetes, where the body makes some insulin, but not enough. But the way that insulin works, it acts as a key to open up body's cells so they can utilize glucose as a fuel. And with type 2 diabetes, that doesn't work, and that's called insulin resistance, which is important. We'll come back to that. And then the third most common is the type that comes on during pregnancy.
Pregestational diabetes.
Exactly. And that typically goes away after pregnancy, except in African American and Hispanic women. It can come back at a very high risk. So the reason why people don't know that they have the disease is that your blood glucose has got to more than double before you have the classic symptoms.
What's a normal blood glucose level?
About 100.
Okay. So if you go 200 or above, you're starting to get in dangerous territory.
Right. So the symptoms are you feel thirsty, you're going to the bathroom a lot, you can lose weight, and you have reduced energy. So you can have diabetes and not have any of those symptoms, or you don't know you have the symptoms because it comes on so gradually.
And they can be so mild that it goes unnoticed. Let me see if I can squeeze in a call. We have Bridget on the line from Baltimore City. Bridget, go ahead with your question.
Good afternoon, doctor.
Good evening.
I'm type 2 diabetic, and I wanted to know whether or not I'm insulin dependent. Is there any way ever that I can get off of insulin?
How long have you been diabetic? How long have you been taking the insulin?
At least 2008.
Okay, so for a few years now. Okay, thank you for your question.
Thank you.
Thank you. Well, it's obviously, Bridget, I can't talk to your precise case, but what I can say is that typically the longer you have diabetes, the less insulin that you produce. And even with type 2 diabetes, that if you have the condition for 20 or 30 or 40 years, by that time you don't produce very much insulin. And so about half of the people who have type 2 diabetes are on insulin.
So the chances of her getting off of it are not likely. Okay. Once you're diagnosed, what's the treatment plan look like? Because it involves a wide variety of doctors and specialists, right?
Right. So it depends on what type of diabetes you
Correct.
have and how long you've had it. So if you have type 1 diabetes, then you have to have insulin. If you have type 2 diabetes, then about 1 in 10 people can be managed without medication. And that's physical activity and also diet and making sure that you do a good job with your weight.
Yes.
And you may have asked before, what are the ways to prevent diabetes? Physical activity is very, very important.
You want to keep down your blood pressure. You want to keep down the stress levels. Let's see if we can squeeze in a quick call. We have Gloria on the line from Carroll County. Gloria, you have a question?
Hi.
Hi.
My husband's a type 2 diabetic, and he has these real severe night sweats. Do they cause, is that from the diabetes?
Well, Gloria, is that there's two extremes of blood glucose in diabetes. There's the high blood glucose, which means you have the disease, but sometimes you can take medication that causes your blood glucose to go low, so-called hypoglycemia. And sweating can be a symptom of a low blood glucose. So typically if you're taking insulin or some pills that can increase your body's ability to make insulin, can cause these insulin reactions.
All right, we're going to see if we can get another call in there. We've got Dawn on the line from Martinsburg, West Virginia. Dawn, you have a question?
Yes, I was wondering how I felt about the children going on the insulin pump. My daughter's 10 years old and she's type 1 diabetic.
Okay, thank you so much for your question.
Thank you, Dawn. I'm a big fan of insulin pumps, and I'm also a fan of checking your blood glucose regularly. And sometimes you can now get these continuous glucose monitors or sensors that can be linked to an insulin pump, and I think they really help control blood glucose. They tend to prevent the highs and the lows.
As many as 1 in 3 Americans will develop diabetes by 2050 if present trends continue. What's behind that? Are we a more obese nation? Are we more sedentary in our lifestyle?
So yes to both.
All of the
them.
above.
Yes, and even type 1 diabetes is increasing, and people are thinking maybe it's air pollution, maybe be driving that, but the increased body weight and earlier we said that typically juvenile onset diabetes you had to have insulin. Now the most common form of diabetes in children is type 2 diabetes. And unfortunately, kids with type 2 turn into adults with type 2, or overweight children turn into overweight adults and increase the tendency for type 2 diabetes.
We're going to talk about some statistics about it being hereditary in a second. But let me see if I can get another call in here. We have Anne-Marie on the line from Montgomery County. Anne-Marie, go ahead.
Hi. I have a question about what is your recommendation for diet with respect to diabetes in terms of what percentage of carbs, fats, and protein do you recommend?
Excellent. Thanks for the question.
Yeah, Anne-Marie, I think that is an excellent question. I think you need a balanced diet, but you want to make sure that your diet is somewhat reduced. And recently there has been recommendations that people shouldn't eat sugar. And sugar is bad for your teeth, especially with kids, but I'm not sure that there's any evidence. In fact, there is evidence that sugar by itself does not cause diabetes. So you want a balanced, nutritious diet.
Let's see if we can squeeze in one more call before the show ends. We've got Robert on the line from Prince William County. Robert, go ahead.
Yes, doctor, I wanted to find out if there's any cure for type 1 diabetes within 1 to 5 years in the future.
Well, you're talking to the right man. He's a researcher there. So that was my last question about what are you looking at in terms of understanding and get a better sense of diabetes and preventing it in the future?
Okay, Robert, so again, an absolute fabulous and very important question. I think with regard, it depends how you define cure. I think if we could develop an insulin delivery device that was linked to a continuous glucose monitor so that the monitor would know exactly what your blood glucose was doing and allow the insulin delivery device to give precisely the right amount of insulin, then maybe that would be a cure. And I think we are marching towards that. At the moment, stem cells or replacements for the diseased pancreatic cells that make insulin are much further away than 5 years, but there's a lot of work going on to investigate
Very
that
optimistic
possibility.
moving forward?
Yeah, we're cautiously optimistic.
Cautiously optimistic. That's always one way to look at it. Well, Dr. Stephen Davis, we really appreciate you coming in and talking with us a little bit more about diabetes. Clearly, this is an issue that a lot of people want to talk about, as indicated by our phone calls this evening. So thank you so much for your time.
Thank you, Linda.
Your health segments are a co-production of Maryland Public Television and the University of Maryland Medical System.